So dad has told me that his son was eating a grape and is no longer speaking. So the first thing that I'm going to do is I'm going to check the scene, make sure it's safe to intervene. And then I'm going to ask the father for consent to be able to perform back blows on the child to try and force the object out of the windpipe. So in order to do a back blow, once I have consent, I place the baby face down on my thigh and hold the bottom of the head, kind of where the neck area is, with the palm of my hand. I make sure that the baby's head is lower than like tilted down, and then use the heel of your hand to strike right at the back between the shoulder blades, kind of, to deliver a back blow. Kind of looks like this, and you do that up to 5 times. If the infant goes unconscious, you then lower them down to the floor like this. You encourage the father to call 911. Then you begin CPR with two rescue breaths, using the infant breathing barrier, and then do 30 chest compressions using 2 fingers right at the middle of the sternum, going down at most 1.5 inches. And then you do 2 more rescue breaths. And the object has surfaced, so I fish it out of the baby's mouth. I then check for the ABCs, so airway, breathing, circulation, severe bleeding. The baby has no pulse. I don't see any bleeding. So I'm gonna check the airway. The airway's clear. The object's already come out. And then I check for breathing. So I'm gonna look, listen, and feel. About 5 seconds. So with no signs of life, you continue CPR with 2 rescue breaths. And 30 more chest compressions. And you continue CPR for 5 cycles if you have someone to pair off with that can replace you, or if the victim shows signs of life or a higher trained medical professional arrives to help.